And now it's time for cases. So go ahead and pull up the pathway either on the hub or if it was emailed to you so you can follow along as we go through the cases.
So case number 1 is a baby that's not going to be requiring phototherapy. This is going to be your large majority of cases on the newborn baby mother unit on the floor. So this one is our baby at 39 gestational age of weeks. Mom is type AB positive, which means she does not meet any of the 3 criteria that would require us to get a cord blood at time of delivery. Therefore, our first TCB check will be at 24 hours of life, and then daily, each day at 5 a.m. thereafter. Remember, just the 5 a.m. timing is really for discharge planning. So our first TCB at 24 hours of life is 4. And if you can see in our first row, right on the top right part of your screen, our threshold of when we would want to confirm with a TSB, a serum level, is 9.9. So at this time, we will not get a TSB. We will continue with the daily TCBs. So our TCB at the next day is 39 hours of life. The threshold for getting a TSB is 12.4. Again, we're below that level at 6.3, and so we'll go ahead and discharge this baby in the next coming days. If discharging less than 72 hours of life, then follow up within 3 days in the PCP outpatient setting.
And this Billy Tool follow-up is based off of how close to the threshold you are. So you will see as you do more Billy Tools that sometimes it'll say follow up within 24 hours, but since this one was so far from threshold, that's why it is recommending 3 days.
So this is case number 2. This is going to be a baby that does require phototherapy. So this is also a 38-week-old male. Mom is AB positive, antibody screen negative, so again, does not meet the 3 criteria for collecting of cord blood at time of delivery. So we get our TCB at 24 hours of life. As you can see, the TCB is 12.9. If you look at the first red row, our threshold of when we want to get a TSB, a serum level, is 9.4. Therefore, we'll need to get a TSB. You can see that the phototherapy threshold is 12.3, but because this is a TCB, we will not start phototherapy. You need to get a TSB first. So now we get a TSB a couple hours later. That level is 13.8. Our threshold for phototherapy is 12.6. Therefore, we will start phototherapy. Upon your next collection of TSB, you will also collect a hemoglobin and a hematocrit, a direct bilirubin, and a retic count. Now, we always want to evaluate for concern for hemolysis. If there's no concern, we would continue 12 hours. We would get the TSB repeated at 12 hours after phototherapy initiation.
And it's important to remember that with these babies, you have to go to the mom's room and to talk to them about adequate feeding. So the only way to eliminate bilirubin from the baby's bodies is to make sure that they're feeding well so that comes out in their pee and then in their poop.
Okay. So for discontinuation, we want our TSB to be decreased to below the original phototherapy threshold. So if you go back a couple of slides, you can see at the time of phototherapy initiation, the threshold is 12.6. So this is the level that we want our baby to be beneath at time of discontinuation of phototherapy.
So it would be 2 below that. So it would be at 10.6, which is where you would be able to, based on the AAP guidelines, discontinue safely.
Always reassess for need for rebound. So criteria for rebound, being high risk, phototherapy was started within the first 48 hours of life, their gestational age less than 38 weeks, or if they're Coombs positive or concerns for hemolysis. So this baby is in fact at a higher risk for rebound hyperbilirubinemia because they were born before 48 hours of life. So instead of waiting to repeat the TSB, we will go ahead and repeat it within 6 to 12 hours after initial discontinuation.
So in our next case, this is a baby that's going to be Coombs positive. So he is a 39-week-old male. Mom is O positive, antibody screen negative. So since mom's is O positive, we have to collect a cord blood. So this baby is A positive, Coombs positive, and based on this, that means you have to collect a stat TCB, and you'll keep collecting them every 6 to 12 hours thereafter. So now and every 6 hours after for the first 24 hours life, and make sure you encourage feeding because these babies are at higher risk for hemolysis and therefore higher risk for hyperbilly. So the first Billy at 2 hours was 3. So we look at our Billy tool, it's all green, so we should be happy. The confirmatory TSB would be at 3.7, which they are below. So then 6 hours later, we will collect again, and they are now at 8 hours of life. So at 8 hours of life, the total Billy is 8.8. So then we look at our Billy guidelines, and it says that at 7.7 you would have to initiate phototherapy. However, this is a TCB, so tricked ya. We do not collect it yet. We have to get a stat TSB. So now we'll get the stat TSB at 9 hours. The level is 8. You see that the level went down. That can happen because TCBs tend to overestimate. So even though the level went down, don't think that the bilirubin is actually going down. It's just a more accurate number now. So the phototherapy threshold here is 7.9. So based on this, we do have to start phototherapy. And as Amber mentioned on the next slide, when we start phototherapy, you want to order an H&H direct bilirubin level and retic with your next TSB. So this is just an overview of the guidelines, just to have it all in front of you. We can also pull it up to follow along.
And remember, final words, this is a clinical pathway, so it's a great reference for us, but we always want to use our clinical judgment in times like these. Remember to always have conversations with your attendings about proceeding, discontinuing, and rechecking for hyperbilirubinemia. Best of luck to you all, and we're excited to see you on the wards.
Good luck, and remember to ask for help if you need it.